The second pivotal experience in my life would have to be having spinal surgery, where I would have to have 2 rods down my spinal column. And so, you know how, I don't think they do it now. It may be a little bit different. And perhaps I'm dating myself a little bit, but in school, they used to do the screenings where they would check your hearing and your vision, and they would do like a little test on your back for scoliosis. So at this point, post hospital, I'm back in school, regular routine checkup that they do in school. In this particular time, they say to my parents, you may want to have her checked out, see a specialist, because it seems like she has a certain curvature of her spine based on our assessment. So, you want to take her to go get a second opinion. So we go see a specialist, and they tell my parents that I have like a 20-degree curvature of my spine. I believe that's what it is. I don't know. But my spine is kind of looking like an S. And to remedy that, because I was young, they were like suggesting a brace. So I had a brace that would come from like right under my breast to slightly past my hips. And I would have to wear the brace for 16 hours a day. And I was like, I am not wearing this thing to school because kids are going to laugh at me. And, the way it makes you sit, you're up like this. And I was just like, I'm not doing that. And it was uncomfortable too. So my parents were like, is it possible that she can wear it when she comes home, until she gets ready to go to school? And the doctor, he was like, that's fine. So I wore that for some time. And then eventually I outgrew the brace. And I was saying to my mom, something is wrong, because I feel like my ribs are going into my side and I can't really breathe good. So my mom took me back, and this time the doctor was saying, because of the curvature, she's not wearing a brace anymore because it was too small. Her ribs are starting to turn into her lungs, so it's making it more difficult for her to breathe. If you don't do something now, over time, what could eventually happen is it could get worse, and she could be hunched over, or she may not be able to walk. And I remember my parents saying that's not a decision they wanted to make, to have surgery, only because there was a 1% chance that they hit something wrong and I could be paralyzed anyway. And so it was like, if you don't do anything, you could be at risk of not being able to walk. If you do have the surgery and there is the slightest error, I could be paralyzed and not be able to walk. So my parents was like, we could not make that decision. Around this time, I was in high school. It's like I was going into my junior year of high school. And I can remember asking the doctor questions like, would I be able to have children? Would I be able to carry a baby? And, what is the scar going to look like? Because they literally cut my back open like a book. And, just thinking, nobody's going to want me. It's going to be so ugly. I'm going to have this scar. I thought I was going to say the most humiliating time of my life. But I don't know if that's the right word just yet. I would say humbling. Because once I was in the bed, I couldn't turn myself the way, you get in the bed, you turn one side, you turn to the other side. I didn't have the liberty to move my body myself. So if I felt like I was in a position for too long, I would have to call my parents, who, if it's the middle of the night, they have to wake up. Both of them would have to come, and they would have to pull the sheets so that I could roll over. And because of the incision on my back, and I had staples, it would pus. And so I could only wear white t-shirts, and the t-shirts would get stuck to my back. So now I have to have them pull the t-shirts off slowly so that I could change it, because now that one is soiled with pus. And again, I have to lift my arms and do all this movement that is excruciating. I also can't get up and go to the bathroom by myself. So now, again, at this point, my parents are back at work, so they will alternate weeks of being home with me. They have to help me go to the bathroom. But not only that, they have to wipe me, because I can't move and turn my body to reach and wipe myself. So with my mom, it was kind of okay, because, that's your mom. But with my dad, I know that it was as awkward and uncomfortable for him as it was for me to have my dad have to wipe me at 16 years old because I couldn't do it myself. I still remember that. And that part we don't talk about, but I have such an appreciation for my parents because they did it without ever complaining or making me feel uncomfortable. But my mom at some point was like, oh no, you're going to get your butt out this bed and you're going to walk down the stairs. And I'm like, Mike. So my mom was definitely like, nope, at some point you got to get up, you got to move, you can't. And so I started to be able to move around more. It went from me scooting down those 17 steps to I could walk down the steps, 1 foot down, the next foot down on one step, and do that again until I got down, until I was able to slowly move around by myself. That experience taught me so much about how much we take for granted. You get up in the morning, you don't think about, your brain telling your legs to move and turn and put your feet on the floor. You just do it. I can remember having to talk to myself. Okay, Aaliyah, swing your leg off the bed. Then swing your other leg around and put your arm under you so you can push yourself up. I remember having to literally talk to myself to tell myself, this is what we have to do to sit up. Not even stand up, just to sit up in the bed. You don't think about those things until being in the unfortunate situation of not having those abilities. So it really taught me about, how thankful I am for the smallest of things. From once being paralyzed and I couldn't do this, to having surgery and I couldn't move my body, I couldn't move my limbs. I have such an appreciation for the smallest of things now. It also helped me to see how much my parents absolutely loved me. Because, you hear it and you think, oh yeah, they're my parents, so they have to love me. That really showed me how much they love me. The sacrifices that they made for me. What it also taught me is not only how resilient the body is, but how powerful the mind is. Because when my body was telling me I can't do this, my mind was saying, we will do this. And I think the last and perhaps most important thing that I learned from that situation is that I can do hard things.